So sir, please tell us what type of surgeries can be done in breast cancer?
Since breast cancer is very common and especially women, and we are seeing nowadays more and more in younger women, and it is associated with the psychological impact after the surgical treatment. Basically, since surgery is a part of the main important aspect of the treatment in breast cancer, so most of the time when we remove the breast, they may be psychologically upset, and cosmetically also they might not be appealing. So there are modifications of surgery wherein we do remove the tumor with surrounding normal tissue with retaining the breast. That can be look like near normal, and we are doing oncologically ideal surgery to prevent the occurrence of the cancer and treat it completely. This is called breast conservative surgery, wherein we are not completely removing the breast, we are just removing the part of the tumor and surrounding areas. This is one aspect. Other than that, sometimes we may not be able to do only breast conservative surgery, we may have to remove the complete breast. In such cases, what we do, we can do reconstruction of the breast. That is, once we remove that, we can place tissues from the other parts of the body, like we can take tissue from the abdomen, place it here, and the cosmetically wise it looks near normal to the opposite breast. We can reconstruct a nipple areola also, so no need to worry about the cosmetic outcome. We can reconstruct the breast itself, and there are so many options for that. We can put an implant, silicone implant can be kept. We can take tissue from the back, we can take from the tissue from the abdomen also, and there are less invasive approaches for the breast cancer surgery, wherein since we are removing the breast, and removing the swellings in the armpit is also very important aspect of the treatment. So that is called axillary dissection, wherein all the lymph nodes in the axilla we remove. Nowadays in early stages, what we do, we don't remove all the lymph nodes. We check whether the only lymph nodes which are involved or which might be involved can be removed by technique called something called sentinel lymph node biopsy. In that, what we do, inject a dye or a medicine near the tumor or the nipple areola, and then we open here and remove only those swellings which are picked up by the dye. That means these are the swellings might be the chance of spread from the breast to here. So if we remove that, and we'll check whether there is spread to that swelling or not. If there is a spread, we have to remove all the swellings. If there is no spread, that would be sufficient as a treatment. This is because if you remove all the lymph nodes in the here, there is a possibility that increase in the swelling of the limb, there can be pain, numbness of the limb after the surgery. To avoid these side effects, we are modifying the techniques and we are doing it with less invasive procedures to give optimal results. So result oriented, results are same, but cosmetically better, and functioning wise and the patient to recovery wise, everything will be better compared to the complete removal of the breast and complete removal of the axillary nodes.